Right, so what am I going to talk about? Well, I was thinking about talking about having a diagnosis of personality disorder. I don't know why I'm making this video, to be quite honest. I feel really awkward, and I feel really. I mean, I do talk to myself at times anyway, so you think, hang on, shouldn't be that difficult, really. But I don't know. I feel really odd. Ooh, talking to a screen. But I don't know why I'm letting it bother me, really. I don't know. I mean, like, if I'm talking to a human being face to face, I find it a bit easier. Funny enough, I can communicate with a human being. It's easier. You know, I guess I've had a lot of practice. You know what I mean? Being around human beings most of my life, in one way or another. But talking to a screen, it's just, I don't know. It feels really unnatural. Whatever. I don't know. Or is it? Whatever. But yeah, borderline personality disorder is the diagnosis that I have, and you know, sometimes it's quite difficult to live with. Sometimes, I don't always like being the way I am, but you have to live with it. It's like living with anything. Living with any kind of medical condition or illness, whatever. You have to find ways of coping with it. Sometimes I cope reasonably well, and sometimes not. At the moment, I'm going through a pretty hard time. I'm not coping very well at all. My anger keeps rising, and you know. Thing is, it's difficult sometimes to keep control of it, because, do you know, I guess sometimes when I feel like this, the way I do, I feel so powerless, and it's really hard to describe, but it's like a feeling of complete and utter emptiness, and I don't know, sometimes it's hard to convey things in words. It's funny, I can explain these much better to an audience than I can to a bloody computer screen. You know, it's funny that, because I deliver a thing called the cuff training, KUF, which is understanding. No, oh God, blimey, hang on. Say out loud. KUF, knowledge and understanding framework, which again doesn't really tell you a lot, but I co-deliver it with professional people. As an ex-service user, I deliver this training, and it's about raising awareness about personality disorder amongst staff, whether it be hospital staff, you know, psychiatric, or you know, housing, frontline staff, essentially, people that, you know, at some point or other will be dealing with people like myself, essentially, you know, through the system, one way or another. And yeah, sorry, completely forgot what I was going to sidetrack myself. Yeah, so like I say, I can talk about this stuff far more easily, whatever. I can talk about it a lot easier to an audience of people, because I guess I'm passionate about it and I want people to be able to understand. You know, particularly professional people, but also anybody, general public, anybody. You know, people to try to understand that, you know, having this diagnosis, you know, doesn't necessarily mean that you are some sort of raving loony or whatever, you know. Yeah, sometimes it can feel like that, especially inside your own head. You know, it can feel like that, and it's not always very nice. Um, but essentially, basically, we're just normal people, just everyday people, really. It's just that we experience things a lot more extremely, in terms of our emotions, particularly. Um, somebody once described it, and I thought it was a really apt way of describing it, to be quite honest. Like being an emotional burns victim. You imagine somebody that's got burns, say first degree burns, and you can imagine just what kind of pain level that person would, experience if it's like a first degree burn, or like 96% of their bodies, pretty burnt sort of thing. It just boggles the mind, the kind of sensitivity of that person's, if all their nerve endings are sort of exposed, you know. And in terms of, my diagnosis at least, that's very much what it's like, but on an emotional level. So, slightest comment or slightest, word said here and there it's amazing, that could cause more pain than if you punch me in the nose. If you punch me in the nose, then the pain's not going to last forever. It's going to go away eventually. But you call me a name or something hurtful, or you don't like me or whatever, then that's going to hurt far, far longer and far, far deeper. Like I say, I think words sometimes are quite inadequate to describe emotions and feelings. Sometimes they're very difficult things to describe. Most of us don't generally speak about our feelings on a day-to-day basis. Generally, when we're going through our business, whatever, whether we're at work or wherever we're doing, going shopping in Tesco's or wherever, you're not really going around talking with people and sharing about how you're feeling generally. Although the checkout people do tend to, hello, how are you? Are you okay? Do you really want to know? Sort of thing. I mean, I know it's just being polite, and I guess it's nice enough. It's rather than being miserable, I suppose. But there are times when they ask that question, you really just think, oh God, do you really want to know how I feel right now? I don't think you do, not really. Oh dear. But yeah, I don't know. I don't know why I'm making this video, to be quite honest. Funny though, I'm doing it, the more I'm starting to feel a bit relaxed, funny enough, and it's starting to get a bit easier to be doing it, strangely enough. I suppose it's like most things in life, isn't it? Once you've done it once, and once what's the name, and you practice you get quite used to it, I guess. I don't know. Human beings for you, very adaptable creatures. God blimey. But I said I was going to talk about personality disorder. Well, I guess I am, in a way, just on a very personal level. But yeah, as I say, I'm not really doing too well at the moment. But I mean, on materially or look on paper, my life's fine. Do you know what I mean? I've got a lot of good stuff in my life, a lot of good things happening, and compared to where I was, well, oh God, I can't even remember how long ago it is now. But we're talking maybe 8 years ago, maybe something like that. I was homeless. I was on the street. I was begging for money. Do you know what I mean? I was drinking and all the rest of it. And if I sort of compare to what I've got now, it's a million times, different and better. But it doesn't really matter where you are. You could be in a palace. You could live in Buckingham Palace. You could live anywhere where if you feel the way you feel, it doesn't matter the amount of money you've got, the status you've got, whatever. If you feel crap, you're gonna feel crap, regardless. So, but like I say, still, really, I should be quite grateful because I've got a heck of a lot in my life compared to, what a lot of other people have got out there. Sorry, I'm messing about with the wires on my computer because it's got stuck under the thing. God blimey. Oh dear. Yeah. Yeah, that's another thing as well. The screen went blank on me. Oh no, stop it. Um, yeah. What was this? Oh yeah. I also am a little bit OCD, so that's why I was messing around with the thing and with why I was trapped under it. Oh, never mind. I'm just drifting onto nonsense now. Sorry. Anyway, I've just noticed that I've now been waffling for about 10 minutes, and I'm going to post this. I don't know why. I post a lot of dribble and rubbish anyway, so a bit more dribble and rubbish isn't going to go, isn't going to make that much difference, is it really? So, like I say, I mean, I don't even think anybody. I mean, there's probably some people that just happen to, just as they're going through the thing, you know, the videos on YouTube, as I do, sort of thing. You know, click on something. Oh, what's that? Have a quick look. Blah blah blah. No, not really. Whatever, sort of thing. So I'm sure I get the odd person here and there looking at my videos. I'm sure, but far and few between. And you know, hey, well, I don't really care, to be quite honest. Well, oh no, okay. Let's be honest. A part of me cares about it, of course I do, you know what I mean? Because, like every human being, I want to be liked, and I want to be popular, you know what I mean? Whatever, you know, it's nice to be, you know, it's a nice feeling, isn't it? But, you know, on a deeper level, I really don't care. Not really. I've got a lot of other more important things in my life, believe you me, I really have, and things that I want to do in my life. Far more serious and far more important, to me at least anyway, far more important things to be bothered whether they, you know, people watch my videos on here or not, to be quite honest. But I understand why they probably wouldn't, because they are crap anyway. Sorry, excuse my language, but they're rubbish. Do you know what I mean? It's just me waffling on about nothing basically, and yeah, and me filming my cats and stuff like that, and it's nonsense, rubbish. Do you know what I mean? But it's a bit of fun sometimes, and it's just interesting to see what, if anything, does happen. You know what I mean? I don't know. Okay. No, I'm definitely going to stop because it's now 12 minutes. I'm counting it now. 42, 43, 44 seconds. Alright. Okay. So, bye for now. Maybe I'll do another one of these. I don't know. See ya.